Hello students, let me start with another topic, that's method of patient assignment. I think all of you are familiar with this method. So it is a commonly asking question from this area. So first we can see that what is the meaning of this patient assignment method, or different synonyms we are using: nursing assignment patterns, nursing assignment system, and organization mode of nursing care. So these all are some of the terminologies commonly using. So we can first see the meaning and the definition of patient assignment method. So patient assignment is delegating duties to the trained nurses for the care of a group of patients admitted in the unit. So how we are assigning the patients to the nurses in a particular unit, that is the simple meaning. Then the method of patient assignment, it is a process by which nurses deliver the care to the assigned patient. എങ്ങനെയാണ് അസൈൻ പേഷ്യൻറ്റിന് കെയർ കൊടുക്കുന്നത് എന്നുള്ളതാണ് പേഷ്യൻറ്റ് അസൈൻമെൻറ്റ് മെത്തേഡ് എന്ന് പറഞ്ഞാൽ. ഓക്കെ, സോ നെക്സ്റ്റ് വി ക്യാൻ സി വാട്ട് ആർ ദ പർപ്പസ് ഓഫ് പേഷ്യൻറ്റ് അസൈൻമെൻറ്റ്. First one, to provide nursing care to patients in an efficient and effective manner. By using this patient assignment method, we can provide efficient and effective care to the patient. Second, describe a structure to the organization nursing workload. So we have to have a formal plan how to give care to the patient. അതിന് വേണ്ടിയിട്ട് ഇത് ഓർഗനൈസ് ചെയ്യാനായിട്ട് നഴ്സസിൻ്റെ വർക്ക് ലോഡ് അറിയാനും നഴ്സിംഗ് master plan undakkanum we need to have a patient assignment method. Then identify the types of healthcare personnel in providing nursing care. Maybe a professional nurses or non-professional nurses for some aspect. So we should know that what type of healthcare personnel required. Then define the boundaries for the distribution of work and the delegation of authority. By the patient assignment method, we can select the or we can assign the particular task to different types of personnel. So these all are the purposes of patient assignment. So next we can see the principles of patient assignment method. So first one is assigning the task, assigning the staff of patient care by the head nurse. Okay, the head nurse is assigning the patients for each unit. Second one, follow the departmental policies. We have to follow the departmental policies for how to arrange, how to distribute the patients. Then, considering the patient's need, unit activities and the geographical location of the unit. Patient's needs also we have to consider, and what are the unit activities, other activities to be performed, and how this unit is planned. Okay, that's the planning of the ward configuration it called us. Okay, Riggs pattern or H shape, L shape, or what type it is. Then assigning equal and balanced workload among the staff on duty and rotation. So we have to make sure that equal distribution of the workload to the various categories of personnel. So we can arrange, in busy days we have to have more staff nurses than the less busy days. Okay. Then considering capabilities, experience and interest of nursing staff. So according to, for a fresh staff, when we are comparing to an experienced staff nurses, make sure that how we are allocating the patient to the staff nurses. Then assuring continuity of care and selecting the method well in advance. So on the basis of, if we are doing the patient assignment method, so we can assure the continuity of care. Okay, we can assign the staff according to the need of the patient. We can plan it in advance. Next, documenting and making everyone familiar. So it's very useful for documentation purpose also, and it is useful for the who all are working there in the atmosphere on that organization. That's regarding the principles of patient assignment. I think the points are clear. 7 points are there, so just to review that. Then what are the factors influencing the patient assignment? First one is the availability of nursing workforce. That means we have to have sufficient number of trained nurses or assistant nurses. On the basis of that only we can assign the patient to the staff. Okay, we have to choose the mode of patient assignment on the basis of that institution's policy of how many staff they are hiring. Then the severity of illness. We know that if the patient is very sick, usually we are assigning 1:1 in the intensive care unit and CCU and all. And if the patient is ambulatory, there we can assign more patient to the staff nurses. Then organizational complexity. So what type of organization they have in that particular institution? It's a referral hospital or it's a general hospital. So on the basis of that, this organizational complexity is varying. Then patient characteristics. Patient characteristics include age, length of stay, stability of condition, and difference in the care, and unpredictability of care, and time of admission. So many things are there. Okay, for a pediatric patients, we need to consider a different aspect. When we are comparing to the geriatric patient also, it's like that. That's the meaning of patient characteristics. Then comes the physical design of the unit. Already I had told you, maybe in a room assignment, or maybe that method of assignment is functional method, or maybe the patient need continuous observation. So what type of configuration of the ward, like rooms and wards are there, or cubicles, or H shape, L shape, T shape, different configurations are there. So on the basis of that, we can arrange the number of staff. Then nursing resources. So percentage of qualified personnel and ancillary staff, that means supportive staff. That ratio reflected in the patient assignment methods. Then organization support. That means the presence of a physician in a ward, or the what type of communication between the nursing and doctor on duty, and what is the documentation process, and shift rounds, timing, everything will influence the organization. Organization support is very important. Then financial health of the institution. While selecting the method of assignment, so we have to consider the financial status. That means if they can afford a more number of staff nurses or registered nurses, so there we can utilize different mode of patient assignment. Then recommendation of the accrediting body. That you know that the licensing body like INC determine the staffing and method of assignment to meet the quality of care standards. Different staff accrediting agencies are there. For example, I told you Indian Nursing Council, they have given the norms. On the basis of that, we need to have a nurse-patient ratio for different areas that we have to consider. So these all are the factors influencing the patient assignment methods. I think it's clear. Then we can move on to the directly. I am moving to the method of patient assignment. That's depend upon the nursing care delivery system. So here they have given the traditional and most common one only: private duty nursing, case method, functional method, team nursing, modular nursing, primary nursing methods. So we can see each one. First one is the private duty nursing. So that is one nursing care for one client, that we know that is the traditional one, and according to the system, the private duty nurse is responsible for the patients giving total care. Okay, the advantages based on needs of the patient, focused on the therapeutic nurse-client relationship. It increases client satisfaction with the care delivery, because one nurse is for giving entire or total care to the patient. But there are some disadvantages. We know that 1:1 care, it's very costly, and there may be a low efficiency if the staff is not well prepared, but its job mobility is because after completion of care to that particular patient, they may have no more job, they have to look for another job. These all are the disadvantages of private duty nurses. Okay, it's not that much common. Then we can see the common what we are using in the hospital side, that is the case method. First one is the case method. What do you mean by case method? Head nurse is assigning a group of patients to nurses on duty, okay, irrespective of their qualification and experiences. Okay, so the nurses are responsible for the total care of the assigned patient during their duty hours. If 8 hours duty or 6 hours duty, they are assigning 3 to 6 patients. So she is responsible for that patient during her time. Okay. So where there are consistent observation and monitoring required, especially in intensive care, hospice care, home health care units, they are following this type of workload. Okay. The head nurse analyzes the workload and type of patients before assigning them. Where there are less number of staff nurses, it's difficult for the patients to take care of that type of patients. This is the pictorial representation of schematic flow. One head nurse, registered nurses are there, and a group of patients. So total patient care. Registered nurses, they will plan, organize and perform all care of the assigned patients. Okay. When you are writing, you have to draw this picture also. Then advantages of this case method. It's holistic method because the total care is given by a single person. It provides individualized nursing care. That means the patient is getting complete care from the nurses. Then nurses get clear idea about their responsibility and accountability. Okay, they have to plan everything for the patient. Then keep the nurses accountable for the care. She is responsible for that entire shift. Then both nurses and patients get satisfaction. That you know that because continuously they are getting care from single person. Then the disadvantages. The disadvantages of case method: lacks communication among team members, lacks continuity of care, and has a care approach that may differ from staff to staff, and it is expensive if they don't have sufficient staff nurses. That's very important. Okay, because one nurse is continuously monitoring and giving care to the group of patients. So it's during her shift only. After that, somebody else is coming. So continuity care is not there. I think it's clear. Then comes the functional method. Functional method, the term itself is giving you, it's a task oriented method. Okay. Here what they are giving, assigning a patients in which individual nurses perform specific assigned task. Okay. The head nurse is both responsible for the administrative and the clinical function. I have given here some example. One nurse is assigned for taking vital signs of all unit, or another one is responsible for giving medications. That is functional method. Usually we are using if there is less staff nurses, and during the evening time and night shift, majority of the hospitals, they are using this type of functional methods. This is the schematic flow. One nurse is for medication and treatment, another nurse is checking vital signs, and one nurse is assessing and planning the care. One nurse aid is hygiene and comfort for all patients in a 30-bedded unit. I think it's clear the basic aspect of functional method. Then what are the advantages? It has a lot of advantages and also disadvantages. It emphasizes the concept of specialization and division of labor, because one nurse is specialized in a particular aspect and she is giving that particular care to the entire patient. Then it will require less number of nurses, because very fast they can give. For example, one nurse is taking vital signs means they can take it, they are expert in that and they can continue the care in a different manner. Then economic and efficient, then time saving, then competency in task, they are expertised, then establish managerial control over the planning and execution of the job. Head nurse is controlling the entire group. Then minimum articles to carry out the task, because one nurse is handling that particular task, so she can manage it with the minimum articles. Then it has a disadvantages also. This method is task focused and it's not patient focused. This method is task focused and not patient focused. Okay. Then care become more mechanical than humanistic. ഓക്കെ, ഇവിടെ വർക്കിനാണ് ഇമ്പോർട്ടൻസ് കൊടുക്കുന്നത്. അത് ഹ്യൂമൻ ടച്ച് വളരെ കുറവാണ്. കാരണം വൺ പേഴ്സൺ ഈസ് ടേക്കിംഗ് കെയർ ഫോർ ആൻ എൻറ്റയർ യൂണിറ്റ്. And for a single patient, maybe more than one nurse is coming and giving injection and medication. Another nurse is coming and checking vital signs. Another person is coming and giving hygienic needs. So that like it's coming. A number of care providers will look after one patient for different activities. Then no nurse is responsible for overall care of the patient, because it's this very difficult for the patient to concentrate on that. Then neglecting the holistic approach and the individual needs of the patient. Whenever we are saying the holistic approach, that is not here. Then it can be used in long-term care hospitals. So there we can utilize this functional, especially in old age homes and all, we can use this type of functional methods. I think it's clear. Then we can move on to the team method. That's little bit modern type. It's introduced in 1950s because of dissatisfaction of the nurses due to this functional method. So it's very different and it's well planned model of method of patient care. Team nursing is a care model that utilizes a team of personnel comprising of professional, technical and a nurse aide in the delivery of nursing care, led by a nurse leader and bind them together. That's the meaning of team nursing. So in simple meaning, പ്രൊഫഷണലും ടെക്നിക്കലും നഴ്സിംഗ് അസിസ്റ്റൻസും ഉള്ള ഒരു ടീം വർക്കാണ് ടീം മെത്തേഡ്. അതൊരു ടീം ലീഡറിൻ്റെ അണ്ടറിലായിരിക്കും ഇത് ഫങ്ഷൻ ചെയ്യുക. ഓക്കെ, മേ ബി ദാറ്റ് പർട്ടിക്കുലർ യൂണിറ്റിൽ ദേ ഹാവ് എ ഡിഫറെൻറ്റ് ടീംസ് ആർ ദെയർ അണ്ടർ ദ ഹെഡ് നഴ്സ് കൺട്രോൾ. Each ward has a head nurse who assign group of patients and the caregivers to the team leader and facilitate the communication between multidisciplinary caregivers. അതാണ് ഇവിടെ നടക്കുന്ന പേഷ്യൻ്റ് അസൈൻമെൻറ്റ് മെത്തേഡ്സ്. സോ ഹിയർ യു ക്യാൻ സീ ദ ടീം മെത്തേഡിൻ്റെ സ്കീമാറ്റിക് ഫ്ലോ. ഒരു ടീം ലീഡർ ഉണ്ടാവും ഹെഡ് നഴ്സിൻ്റെ അണ്ടറിൽ 2 or 3, അത് രജിസ്റ്റേർഡ് നഴ്സായിരിക്കും. പിന്നെ അവരുടെ താഴെ സ്റ്റാഫ് നഴ്സസ് ഉണ്ടാവും. ദെൻ നഴ്സിംഗ് അസിസ്റ്റൻസ് ഉണ്ടാവും. ദെൻ അസൈൻ ഗ്രൂപ്പ് ഓഫ് പേഷ്യൻസ് ആർ ദെയർ. That is the type of assignment in the team method of patient care. So the planning, coordination, communication, monitoring and evaluation are the critical factors in the success of this team nursing. So the team leader should be efficient in that. Okay, plan, assign nursing care to each team member. Okay, that's the important thing. Then the advantages. Comprehensive care with the use of all expertise. We can utilize different personnel for the expert quality of that particular personnel. Then it allows the personnel other than professional to carry out some functions. ഇവിടെ നമുക്ക് കുറച്ച് നോൺ പ്രൊഫഷണൽസിനെ യൂസ് ചെയ്യാം ചില കാര്യങ്ങൾ ചെയ്യാനായിട്ട്. ദെൻ ദ ഫോക്കസ് ഈസ് ഓൺ പേഷ്യൻസ് നീഡ്സ്. ടീമിൻ്റെ എൻ്റയർ ഫോക്കസ് എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ പേഷ്യൻസിൻ്റെ സാറ്റിസ്ഫാക്ഷനാണ്. ഓക്കെ, group of patient ഉണ്ടല്ലോ. Then communication and coordination is enhanced because they are working under the team leader. Then participation of team members in decision making. When the team leader is planning, she has to make, they are having a periodical meeting with the other team members. Then integration of nursing personnel with the varying skill levels. Highly skilled and less skilled personnel are also utilizing. Then comes the, what are the disadvantages? Here also some disadvantages are there. Continuity of care can be affected due to changes in leaders, okay, team members and patient assignment. That's very difficult. Sometimes we don't have sufficient staff nurses. Sometimes they may not have sufficient assistants. So that will affect the this team method. Then no one person considers for the total patient care. Here one problem is that sometimes the total patient care may be disintegrated, and there is a role confusion among the different members of the team. Then team leader requires to have knowledge and a good leadership skill. She should be efficient, then only they can manage this. Then sufficient number of staff required. That's another problem with this type of assignment. I think this is clear. Then comes the modular nursing. Modular nursing is a combination of functional nursing and team nursing with limited nursing staff. Usually നിങ്ങൾക്ക് എക്സാമിന് ചോദിക്കുന്ന ഒരു ക്വസ്റ്റ്യൻ ആണ് ഡിഫറൻഷിയേറ്റ് ബിറ്റ്വീൻ either functional nursing and modular nursing or team nursing or modular nursing, like that. So you have to be in a position to give answer to that. Okay. So what is modular nursing? It's a combination of functional and a team nursing method with some modification. So we need to have less number of staff nurses we require here, and the geographical location also it may be affected. Then main objective to provide efficient nursing care and enable them to stay near the bedside. So usually the staff nurses are in the where the patients, the geographical area, there itself they are near to the patient. That is the main difference between the modular nursing and other types. Then what are the features and method of work assignment? It is a unit based modular committee is established. This schematic flow I will show you. Here a unit based arrangement of the patient and staff nurses. They have given here geographic patients units, patient care team, staff nurses, nursing aides, and medication supplies, linen, and everything is there near to the patients according to the each unit's needs. Okay, that is the schematic flow. So a number of modules are formed. Okay, ഒരു വാർഡിലിപ്പം 10 പേഷ്യൻറ്റിൻ്റെ അല്ലെങ്കിൽ 20 പേഷ്യൻറ്റിൻ്റെ ഒരു മോഡ്യൂൾ ഫോം ചെയ്തിട്ട് അതിന് കെയർ ചെയ്യാൻ ഒരു ടീമിനെ അസൈൻ ചെയ്യുന്നു. അതാണ് ഈ മോഡുലാർ നഴ്സിംഗ്. ഈച്ച് മോഡ്യൂൾ കൺസിസ്റ്റ് ഓഫ് എ ഗ്രൂപ്പ് ഓഫ് ടെക്നിക്കൽ നഴ്സിംഗ് എയ്ഡ് and the professional nurses according to the group of patients. There are 2 to 3 non-professional members also there. Then open design wards are preferred to practice in this system. Then what are the advantages of that? Advantages are improvement in continuity of care. Okay. Modular nurses are more involved in planning, coordinating care, and that is effective coordination and communication are there. These are the advantages. Then the disadvantages: increases cost to manage this type of module, and long corridors are not conducive to modular nursing. If too much distance are there, then it's very difficult for the nurses or the module members to manage it. It is a time consuming. These all are the disadvantages of modular nursing. I think this modular nursing is also clear. So now we can move on to the primary nursing method. That is the most modern method. That's called, in 1960s it was started. Then what is the meaning of primary nursing? It is defined as a system in which each patient is assigned to a nurse who has 24 hours responsible for the nursing care delivery to the patient. So one primary nurse is there and she is responsible for the patient from the admission till discharge. That means she is the one who is planning the nursing process or nursing care plan for that particular patient. And this is the first formal professional model in the hospital nursing. So here we will see what are the method of work assignment. So the head nurse is assigned the patient to primary nurse, and she is responsible for scheduling for all shift, providing guidance and counseling, and evaluate care given by primary nurse and the associates. That's already I told you. So 24 hours she is managing, and her associate nurses, they are simply doing their task in her absence. The primary nurse is responsible for planning the patient care for a caseload of 8 to 12 patients in a particular section of the nursing unit, and she is delegating the care through written directives during the off-duty hours to associate nurses who follow the plan of care and gives the feedback to the primary nurse. Simple meaning എങ്ങനെയാണെന്ന് വെച്ച് കഴിഞ്ഞാൽ അഡ്മിഷൻ ടിൽ ഡിസ്ചാർജ് വരെ പ്രൈമറി നഴ്സാണ് നഴ്സിംഗ് കെയർ പ്ലാൻ ചെയ്യുന്നത്. അപ്പോൾ അസോസിയേറ്റഡ് നഴ്സസ് ഫോർ ഈവനിങ് ഷിഫ്റ്റ് ആൻഡ് നൈറ്റ് ഷിഫ്റ്റ് ദേ വിൽ സിംപ്ലി ക്യാരി ഔട്ട് ദ കെയർ വാട്ട് ദി പ്രൈമറി നഴ്സ് ഹാസ് planned. In her absence, they are carrying out. If any emergency occurred, they have to consult with the primary nurse and then carry out the or make a change in the nursing care plan. Then, what are the advantages of this team nursing? This method shows quality and holistic patient care. This method shows quality and holistic patient care. There is a scope to establish rapport with the patient. Always they are making a continuous monitoring with the patient. Then patient satisfaction and patient safety is improved in this method. Then help to provide positive patient outcome. Always they can give the positive patient outcome. Then professional nurses feel responsible for the patient care. Then greater job satisfaction is there and there is an increased nurse autonomy. കാരണം സിംഗിൾ നഴ്സാണ് ടോട്ടൽ കെയർ ഈസ് പ്രൊവൈഡ് ചെയ്യുന്നത്. സോ ഷീ ഈസ് ഗെറ്റിംഗ് ദ സാറ്റിസ്ഫാക്ഷൻ. ദെൻ വി ക്യാൻ സീ ദ ഡിസഡ്വാൻറ്റേജസ്. ഹൈ ഡിഗ്രി ഓഫ് റെസ്പോൺസിബിലിറ്റി ആൻഡ് ഓട്ടോണോമി ക്യാൻ ക്രിയേറ്റ് ബേൺ ഔട്ട് എമംഗ് ദ പ്രൈമറി നഴ്സ്. ഓക്കെ, ഷീ മേ ബി ഓവർലോഡഡ് വിത്ത് ദ റെസ്പോൺസിബിലിറ്റി. ഓക്കെ, ദാറ്റ്സ് വെരി ഡേഞ്ചറസ്. Then it's not cost effective. Atra cost effective alla, requires more professional nurses. We require more professional nurses. If poorly prepared, registered nurse may feel threatened. Karanam they need highly skill and knowledge and skill and then updated with all the different aspect of nursing care. Then it requires more number of registered nurses. So these all are the disadvantages of primary nursing. So this is the schematic flow of primary nurse. Primary nurse, the first one head nurse, primary nurse 24 hours, 3 patients plus new admission, 5 patients, like that it's given. And they have given the second floor, primary nurse, day shift, 24 hours responsibility for planning, directing, implementing, monitoring and evaluating patient care. The supportive members are patient assignment, then social service, dietitian, physicians and other health team members, and then associated nurses, head nurse. So these all are the other members she is communicating. Then assistant nurses for evening shift and assistant nurses or associate nurse for the night shift. This is the work assignment in the primary method of patient care. I think it's clear. These all different types of method of organizing the patient care or modes of organization of patient care delivery system. Okay. അപ്പോൾ നിങ്ങളിത് പഠിക്കുക. മേ ബി സിംഗിൾ വൺ ആയിട്ട് ചോദിക്കാം, അല്ലെങ്കിൽ essay ആയിട്ട് ചോദിക്കാം. I think it's clear. So the common questions: patient assignment methods, organization of patient care delivery model, nursing care assignment pattern, primary nursing, differentiate between modular and functional nursing, team nursing, etc. So many questions. Usually one question from this area. It's that much important, this portion. So I think all the points I have covered. You just go through the slides and learn that. We'll see you with another slide. Okay, students, take care. Okay, bye. If you have not subscribed to my channel, please subscribe it and you will get the continuous slide. And if you have any feedback, give me the feedback also. Okay, bye.